Good morning and welcome to all. We're very pleased to be starting a new series on the Millon instruments where we're going to be looking more thoroughly into the evolutionary theory that guides the development of all the instruments, not just the MCMI-4. Some of you may have been participants in webinars that we've held over the last couple of years since the MCMI-4 has been launched. And those webinars have introduced the instrument and gone into some issues relative to different kinds of interpretations and different kinds of problems, and giving examples on the more operational side of it. But what we were thinking about over that time was that it's relatively rare for most trainees these days, and I would say probably even going back in history quite a bit, that a psychologist in training or as they're beginning to learn the MCMI really has the appropriate tools in hand. And the primary tool in hand that we're really talking about is the theory behind it, as well as the perspective on why the emphasis on personality itself. So we took that step back and decided that it would be a good idea to create a series where we would begin kind of with the nuts and bolts. In this one, we'll barely be even mentioning the name of the test, MCMI-4. We may do so for reference here and there, but for the most part, we're really going into personality and personality theory, and then getting much more specific with a lot more of the backbone of Dr. Millon's evolutionary theory. Now, you might ask, what does that really have to do with my enhanced use of the MCMI-4? And if you've ever seen me in a live presentation, or if you've heard prior webinars, you know the answer to that. My answer would be everything. It's probably not absolutely everything. There's a number of areas, particularly with psychometrics, where we could go into quite a bit more detail. And that is definitely a worthy area of exploration, and part of what we'll do as we get further into the series and really begin to operationalize what it is that we're talking about here. But I really believe that being steeped in the theory is the most thorough way of understanding how to move your use of the MCMI or any of the Millon inventories from simply a rule out for personality disorders or evidence of incremental validity towards a diagnosis into a much more nuanced interpretation and ultimately intervention. And we want to be able to keep all of that in mind as we use any of our psychological instruments. What is the purpose of this? The purpose in most clinical circumstances is to help a person improve upon the circumstances within their life. Now, at times there's other uses that are more to inform other officials, possibly the legal system, but in every situation what we're trying to do as best as possible is to give as complete a picture as possible, and to really understand who it is that we're dealing with and what are the challenges that that person might be experiencing. Again, the best way to do this, I believe, is to really kind of come down to the nuts and bolts of theory itself and move into a much more thorough kind of an understanding. So in this webinar, we'll be talking primarily about the theory, and as you go through the series of webinars that we have planned for the fall season, we'll be getting a bit more and more operational as we go along. Next, we'll start to apply it to our interpretation in the second of the series, and from there, we're going to get into certain specific challenges, and that is some of the lesser understood and oftentimes more acutely interesting kinds of presentations. So we have all that to look forward to. But for now, let's take a look at what we're going to be doing through the course of our webinar today. The main topics that we'll be looking at as we begin to talk about start off with the very basic and fundamental question: why focus on personality and personality theory? Now, just a few days ago, I was out at a live training, and I was asked this question, and it kind of surprised me because I've never got this question before, and yet it still is out there. And a person asked me this question: what would you call a working definition, a fairly something that we could all kind of grasp onto, a fairly good working definition of personality itself. And it kind of stopped me for a moment. There's the way that we tend to describe it within the Millon way of looking at the clinical picture, but I didn't have an answer readily at hand. And, I did the best that I could, but we had actually put this question to the test for this webinar today, and I'll be covering that in just a little bit. And then why focus on personality and personality theory. So that'll be the part one that kind of gives you the overall backbone to what it is that we'll be talking about. The second part is the major part of what our focus will be today, and that is to go into a bit more detail than we have in the past for Millon's evolutionary theory. Those of you who have attended some of these webinars or have been to a live conference or a live workshop probably have heard me speak to some detail about this, but we're going to be going even a bit further and breaking it down to some of the dynamics of the personality theory itself, starting with the basic definition of what are the assumptions of the personality theory that Millon put together, and then moving into how does that then begin to generate what it is that we look at on the MCMI and all of the Millon instruments. So that will be our overall view today as we work our way through this hour or so of our time. Towards the end, I am hoping that we've put together about enough information to fill up 45 to 50 minutes of this hour with good content, with what will hopefully be some thought-provoking issues that may bring up some questions towards the end. So at the end of this period, I'm hoping to have some time to be able to get into some of the questions that you might have. Okay. So to kind of start our ball rolling today. So one of the things that we really wanted to do was to take a look at, outside of what we're speaking about just in the immediate, that is personality assessment. How do we define personality as a general construct? And what's the point of really looking at that? So I looked at a number of sources to try to come up with more or less of a textbook definition. And one of the better definitions I found was from Alan Kasdan's 2000 Encyclopedia of Psychology. And this is a quote that is an actual quote. It's pulled from, not exactly adapted from, that Encyclopedia of Psychology definition. And that is, we look at personality as individual differences. Most of us understand that. Individual differences in characteristic patterns of thinking, feeling, and behaving. Those are three of the big domains. The study of personality focuses then on two broad areas. One is understanding individual differences, in particular personality characteristics such as sociability or irritability. The other is understanding how the various parts of a person come together as a whole. So for a general definition of personality, this covers a lot of the ground of what we're talking about. I think that Dr. Millon's theory defines it a little bit further, and of course, the majority of what he had worked on had to do with personality dysfunction. But within that, we have to have an understanding of general personality and general personality functioning and how that might look in terms of a definition. So we have that basic component to look at. We then move on to looking at how it is that we have studied personality. Now, that last definition covered thinking, behaving, and feeling. And that really needs a little bit more fleshing out in certain ways. One way, very literally, fleshing out in terms of the biophysicality of it. All of what you're seeing up here are the different schools of thought, the different ways in which we have looked at the question of what is personality, really from within the field of psychology in general. So we looked at a couple of different variants of this. First, as I mentioned, the biophysical models of personality. How is it that our biophysical self gives rise to the different features of thinking, feeling, behaving, and so on? So we look at neurobiologic and temperamental sorts of theories, mind-body connections, the way that what it is that our physical substrate might trigger different kinds of observable phenomena that we might then call personality. From there, we move, if we're looking downstream a little bit, to behavioral models. We're going kind of from the most basic to the more complex in a number of ways in how we're looking at this. Behavioral models include conditioning, social learning, and some of the more modern behavioral kinds of approaches to looking at personality. That basically is the idea that what we describe is what we can observe. It's very empirical in the way that we look at that. It's very much about not inferring what things are, but looking directly at what they are, possibly being able to infer emotions from that point. But for the most part, really looking at all things being defined through the eyes of behavior. Looking up at the top right, then we move on to the idea of we have more than just behavior. We also have some cognition, and we can't observe absolutely everything, but you can draw some inferences. In that way, we're looking at the phenomenologic mode. That would be one's perspective, one's unique way of looking at and interpreting the world on a conscious level. Within that school of thought, we have several schools, including the existential and humanistic models. We also include within that overall framework the cognitive models of personality, the mindset, the way of thinking about things, the particular ways in which a person tends to interpret their environment and the people within their environment and all the interactions that they may have. Getting to the more complex again, we say that not all of this can be looked at just in isolation of an individual person. We have to really understand what happens between people. That includes behaviors, and that includes phenomenology. That includes their perspective on other people. So within that, we have certain approaches to address personality, to intervene. That includes interpersonal and narrative models of personality, as well as looking at ecological solutions for personality difficulties, as well as group modalities to really understand what the dynamics are between human beings and how does that change our understanding and how does it add to, really, our overall understanding of humans. And finally, chronologically speaking, it's a much earlier model, but to me, probably the most complex of all of them in many ways is the intrapsychic or the developmental models. And that is an area in which only recently, when we're able to utilize statistics that really get after theoretical models such as structural equation modeling, have we really been able to observe this more scientifically. But for the most part, we really do have to use inference to understand the psychodynamics of a human being, the unconscious parts of what gives rise to personality. Now, all of these different schools of thought that we have here are all individual approaches, but just as sort of a precursor to what we'll be talking about and how we put this together in a more operational manner, what does that all mean? And how is that really important to what we're looking at here? In other words, in many ways, what's the purpose of personality study? We have these general definitions of what personality is and what it might represent. But what do we really understand about what happens when you operationalize it? What role does it play in a person's life in terms of the way that they interact with and work with other people and are able to function in their world? And possibly more germane to the questions that we want to bring up when we're assessing personality, particularly when we're assessing personality on more of a clinical level, what role does it play in moderating mental health? If what we're trying to do and what we're trying to accomplish is improvement in a person's overall functioning, why are we looking at personality? Well, the first answer to that question is probably the most obvious of those, and that is the fact that when we have a significant amount of personality dysfunction, we may call it a disorder. And that may be the focus of our clinical attention, although, as we probably all know from our clinical work, it really does go far beyond that, to the point where sometimes it's not necessarily that we're looking at and most of the time probably, we're not looking at personality disorder, but what role does personality function or some areas of dysfunction serve in terms of moderating the kinds of distress that people seek out help for. So looking at how we define personality disorders in today's day and age and how it is that we really try to understand personality and how we map things out to say this represents this component or that component, we look first today to what was done while the DSM-5 was being constructed. And that is, we look at the work of the Personality Disorders Work Group, which largely had an agenda to make major changes to the way that we look at personality. And I don't think that they're misguided in that sense. They're really looking to find less so the labels and more so the dynamics and the domains of what really constitutes personality. Now, there's a lot of debate as to exactly whether they were on the right track or not, but I think as an overall philosophy, they were very much on track. So let's see what they have to say about personality disorders and how we're looking at defining that idea in today's day and age and how we understand personality and our overall concepts of psychopathology and intervention. So personality disorders then represent the failure to develop A, sense of self-identity, B, the capacity for interpersonal functioning that are adaptive in the context of the individual's cultural norms and expectations. Really is a fairly solid definition in that sort of a sense. Now, okay, what they've come up with is looking at how particularly self-identity and interpersonal functioning are adaptive or maladaptive in terms of where a person is and how a person functions in their world. So let's take a look at those components in a little bit more detail. First component that we have is the sense of self-identity. And in personality disorders, we're talking about adaptive failures and ways in which a person is not functioning in their best way. So when we look at impaired sense of self-identity as this first major factor, we have the idea of identity integration, that is somewhat of a limited sense of personal unity or personal continuity, tends to experience different shifts in self-states, belief that the self really presented to the world is not really the organic and genuine self, but something of a facade. The second component, integrity of self-concept, has to do with impoverished and poorly differentiated sense of self or identity. That is, difficulty identifying and describing self-attributes, kind of a sense of inner emptiness, possibly a poorly delineated interpersonal boundary system, and hard to define the self in terms of changes that happen within the social context. And the third element of this first domain is self-directedness, and that is just not an inability, in a sense, to set and attain satisfaction and find rewarding personal goals. There's really kind of a lack of a direction. That sense of being able to self-start is somewhat lacking. The agency of the person tends to be somewhat damaged, if not just diminished in some sort of a way. Part two of this personality disorder definition has to do not so much with just the person in isolation, but the interpersonal realm. What happens between people dynamically. And this has several components too, including an ability to develop empathy. That is trying to be able to understand the mental state of another person and how it is that that person might interpret the events and the feelings that they experience firsthand. Next, a difficulty with intimacy, an impaired capacity to be able to develop close relationships, to be able to maintain those relationships, or be able to function effectively with an attachment figure. Third part is cooperativeness. That is failure to develop the capacity for pro-social behaviors. That is a failure to develop the capacity for socially typical moral behavior. or some absence, in a sense, of altruism or goodwill for other people. And then finally, in this domain, is complexity and integration of representations of others. Within that, they're talking about poorly integrated sense of who another person is, how to separate one from another to be able to understand the I versus the you, and really not be able to completely conceptualize another person as one who is fully detached and fully separate from the self. Forgive me for a moment. One of my controls has, my mouse has decided to not function for me, so I'm switching over to the finger pad, so that changes the way that I operate some of these. So please excuse the timing as far as moving from slide to slide. A final word on what we were just talking about, let me go back to that for just a moment there, is that we have these domain-oriented facets that are aimed to be atheoretical in a lot of ways. And that was really the intent of what the DSM work group really tried to do. But all of this is covered by theory. And in moving to what we're going to be spending most of our time speaking of, and that is Millon's evolutionary theory and how that relates to all of this, what I want to say and what I really want to impress on you is that Millon's theory really incorporates all of what we've spoken about so far, although it doesn't single out these attributes that we've spoken of as the sole attributes. These are part of a more integrated picture that includes not only the self and the social world in the way that we've talked about, but also works to incorporate all the different elements that we spoke about in an earlier slide. That is behavioral functions, biophysical functions, sociocultural, intrapsychic, and phenomenal logic, working all together under the umbrella of an evolutionary theory. That's what we'll be getting into in just a moment. But one of the other components of what the DSM-5 work group really tried to emphasize, and is also a part of the overall picture in Millon's theory, is the fact that we have tended in the past, because of the categorical model, and by past I actually mean what was ultimately incorporated into the DSM-5, which was pretty much exactly the DSM-4 criteria of the diagnostic categories and labels as we know them today, that there's somehow a suggestion of you either have a personality disorder or you don't. And that's really a fallacy. That really is a misunderstanding of how personality functions. And it's not really intended to mean that, but in the sense of how we come up with the medical model diagnosis of any given kind of a disorder per se, that's kind of what we're stuck with in a way. However, really what we're emphasizing, both in the direction that the work group wanted to go, as well as the theory that we're talking about today, is that there's really a continuum. And what we call a disorder is really the further end of the continuum, and not a place where we can make a hard and fast cutoff, so to speak, which is why, although we have certain reference points on the NCMI-4 to say that there's a greater likelihood of personality within this range, we really don't have what we would call a hard and fast cutoff that defines this personality does or does not have dysfunction. There are levels of adaptivity versus maladaptivity throughout the overall scheme. So that really what we're talking about is that what we might loosely call the normalcy of personality, if there is such a thing, is really a matter of degree. This adds to the dimension of the idea of dimensionality in personality that really couldn't be tapped by the idea of utilizing a label and saying, this is what we're looking at, this is not what we're looking at. So we're really trying to move beyond that model in a sense to be able to understand a most functional, in some ways a new way of looking at this overall enterprise. So now let's kind of shift our focus from these more general notions and these more general ideas to the heart of what it is that makes a Millon instrument a Millon instrument, and how it is that we can best put our information into an interpretation of something like an MCMI. And that is beginning really with the theory. And to speak of the theory, we're going to look through many of its major tenets and identify really what is a domain and dimensional system of its own that incorporates everything that the DSM-5 work group wanted to incorporate, but moves beyond that and organizes it through a better hierarchical principle that's outside of psychology proper, that being evolution. So to begin with, we want to get sort of a working definition from Millon's perspective of personality. Here he's looking at the overall view of what constitutes a personality. At this point, we're not necessarily talking about operationalizing it, but the precursor to operationalizing this. And that is, personalities are the only organically integrated system in the psychological domain. The intrinsic cohesion of persons is not merely a rhetorical construction, but an authentic substantive unity, segments of an inseparable biopsychosocial entity, as well as a natural outgrowth of Darwinian evolution's progression. So really what we're talking about here is something that sets up the operationalizing of personality. Really what we're talking about here is how would you define a well-functioning personality versus a not-so-well-functioning personality, and then how would you organize all of those different principles without separating them, without saying that it's most important to look at behavior, and therefore we're going to look primarily at behavior, and maybe we'll consider some cognition, maybe we'll consider what's underneath the hood in terms of a biophysical component, or we're not looking at it necessarily from just an intrapsychic component. What do we not know, and then we build on what we can observe. What we're really trying to do with this method is organize all of these outside of psychology proper so that they all have their own ability to be prominent when we look at the integrated whole. We understand then that not only do we have a biophysical body, but that means something in terms of energy level, which means something in terms of behavior. We also know that gives rise to a certain kind of part that a person isn't entirely aware of. And that's an integral part, that part that has to do with the intrapsychic domain, and so on and so forth, so that everything really can be best represented overall. So we will be talking about the specific areas of personality and how we define personality and the different prototypes that lead to the dimensions. Before we do that, what I really like to do is to highlight Dr. Millon's sense of where personality really belongs in the overall clinical enterprise. To do that, we begin by looking at where it is that we focus our attention in terms of the clinical enterprise. And we draw some comparisons to the field of medicine over the years and what we might call loosely modern medicine. Early on in the years of modern medicine, as we think about it today, those very early times, we think about how it is that we define disorders and where we placed our emphasis in terms of physical disorders. And what we really looked at prior to somewhere around the mid-1800s or so and into the beginnings of the 20th century, the emphasis was largely placed on what it is that we could observe, what it is that was bringing a person into a doctor, to an MD, to be able to deal with some kind of malady, a cough, a fever, what it is that they presented with in terms of symptomology. And really, that's kind of where we are today in a lot of ways. We have much more context, and we do try to be much more integrated in the way that we approach things, but we still largely classify our disorders by this method, by saying that a person is coming in presenting with generalized anxiety, with persistent depression. That's kind of our fever or cough. Medicine used to call one of the more serious disorders consumption. just leave it for that as of right now, because we're going to go into the next phase where medicine then moved ahead into a new era, roughly into the 20th century or so, where we really start to look at what is it that might infiltrate an otherwise healthy body? What might be the causal factors of those symptoms? Maybe we should be treating that. Maybe instead of considering consumption to be the operative way of looking at a difficulty, we should look at underneath a microscope at what infectious microbes are there, and then reconceptualize that as tuberculosis. We do a very good job, I think, in terms of our intakes, in terms of our psychosocial way of finding out more information and gaining context to be able to understand how it is that people are affected by the events of their lives, by the circumstances and the context of their lives, and how it is that that may affect and may bring about difficulties with clinical symptomology. But we're still missing a major part of this picture, that being the role of the immune system. In medicine, we really started to pay attention to the immune system towards the end of the 20th century. In some ways before that, there certainly was some very strong immunological developments throughout the 20th century, but we really only began to notice how prominent it could be and how decisive it could be when we began looking at the problems associated with HIV/AIDS, where you could take two people with a, generally speaking, similar profile in terms of their overall health, both infected with HIV and both having very, in some cases, very drastic differences, all other things controlled for. Compliance with medication, lifestyle changes, everything that can help to affect the best outcomes. But one person will have a very different kind of an outcome than another. And we're assuming, again, that the two people were in relatively the same health, relatively speaking, a similar profile, other than the immune system. And that's really what we're talking about in psychology, that the personality dynamics, as I labeled them here, but really what we're talking about is personality as the psychological immune system. That spectra that we're talking about today really takes the place and the point of being how a person, this is going to sound familiar, interacts with their world, relates to themselves, finds the energy to be able to deal with the difficulties that they might have, the manner and the amount of straightforwardness that they might bring to the picture, the way that their belief system affects things, the way that the components that they don't quite understand themselves continually bring up either effective or less effective kinds of strategies, and in some cases vicious cycles to be able to deal with their world, and how that interacts with everything that we're talking about here, from the circumstances of their life all the way down through the clinical symptomology that they may present with. So for that reason, with that perspective, Dr. Millon, historically speaking, focused very strongly on personality and really lobbied in many ways for that to be the primary area in which we look at the clinical enterprise. And in that way then as well, constructed the instrument so that personality was really at the heart of it, while it integrated the other components in the MCMI, primarily the clinical symptomology. So what makes up a personality? And if you take nothing else from this webinar, I think this coverage of what personalities are, how it is that they have their basic motivations put together, really take a very close look at the next several slides where we're going into each one of these polarities, the three polarities of existence, adaptation, and replication in a little bit more detail, to really be able to understand what it is that we're talking about. So the very first part of this are the building blocks, the prototypes. As we go through these and as you begin to see how they might play out overall in terms of where a person places their emphasis and how how that changes their motivation. Begin to see how each of the MCMI scales are constructed. So to begin with, before we start the first one, I want to draw your attention a bit more to the bottom part and just some of the components that we have here. One moment, I'm going to go back just a second to the, no, we don't have it on here, okay. I'll look at this in a subsequent slide. We're going to begin then with defining each component of this, each of the three major components of personality, evolutionary theory. So Dr. Millon posited that all personalities, all persons really share three primary qualities with the natural world, with all other living organisms. The first of these being the very basic proposition that an organism, in order to have something to talk about, needs to exist, needs to be alive, needs in some ways to be able to exist within its world. And speaking in primarily psychological terms, but metaphoric to what it is that organisms experience in the natural world, that is, we speak about pleasure versus pain. That is life-enhancing versus life-sustaining. And when we define those, we look primarily to the idea of whether or not any organism tends to try to simply stay alive, avoiding those things that are, in quotes, painful, or in a survival sense, those things that could bring about non-existence or death of the organism, versus life-enhancing, trying to get as much out of life as possible. Most organisms are going to fall fairly squarely on one side or the other of this continuum. A successful person will probably have a favored place along this continuum, but will be able to show enough adaptivity and flexibility, straightforwardness within this strategy to be able to navigate the world most appropriately, playing it safe where it's necessary and seeking out greater things where it's beneficial. The next component that we look at then is adaptation, which is the idea that a given person, a given organism, once they exist, they're going to need to navigate their world. They're going to need to figure out how it is that they're going to interface with their environment. And in personality terms, we talk about active versus passive ways of doing so. That is, whether they modify their world, whether they find something that is a suitable environment and they change it to their needs, or in a passive sense, accommodate, change themselves so that they fit into an environment. As you look at these, we begin to see that if you admix different strategies, say active pain versus passive pain, you begin to see very different kinds of personality strategies emerge. The third component of this is replication. And that is based on the idea from evolutionary biology, our strategy versus case strategy. No organism will live forever. Therefore, we have to be able to replicate. We have to be able to make sure that there are others like ourselves to continue the species. Otherwise, we really go into extinction and none of this exists any further for that particular organism. So we have the idea of self versus other, which is relatively self-explanatory when we're looking at personality, basing these ideas then on our strategy versus case strategy, which can be exemplified by two different animals. One, a more basic form of animal, mollusks, shellfish, who replicate by laying as many eggs as possible and really not participating in any meaningful way in terms of the survival of those offspring. And that's compared to the higher mammals, where there's a much more limited number of offspring, but there is a very considerable amount of parenting that happens from one point to the next and to the next. Now, as we begin to look at all of these together, what we start to see is a system in which we can understand and begin to define on a continuum how a person tends to motivate themselves. And that then relates, as we'll see in just a bit, to how it is that the overall system of defining personalities by dimensions, putting them together as prototypes where we do use the label, but we don't limit it to the categories, how that all might work together. We want to be able to emphasize as well that when we're looking at the system, we are looking, again, as we spoke about before, in terms of levels of adaptivity versus maladaptivity. This has always been a part of how Millon has looked at things, but in the most recent iteration of the theory, he went into more detail and broke it down into 3 different ranges, which is also represented on the instruments moving forward from the MCMI-4. It will also be part of the MACI-2 that is under development right now and all of the subsequent developments that we have. We'll be looking at these 3 levels, that is normal style, abnormal trait or type, and clinical disorder. And different modifications for different ranges that we look at with the different instruments, but how it relates to the MCMI-4 specifically relates directly to these 3 different areas. We now look at not necessarily a narcissistic label by itself, but the range of different kinds of presentations. So what we'll look at there are these different categorizations and how it is that we begin to spell out what Millon now calls a spectra of personality for each one of these. If you look across each one of these rows, you begin on the left-hand side with a spectrum that has an abbreviation that relates to the first letter of each of these different iterations of personality. So across the top, we see the AASCHD, which relates to the personality spectra of the schizoid personality. And that is what we see on the far right-hand side, the clinical disorder range. So it begins with apathetic, moves into asocial, and schizoid. Looking down each one of the columns, you see each one represents normal style, abnormal type, and then finally clinical disorder. And towards the bottom, I want to just point out very briefly that there is some shift in the last 3, and those represent what we call, and we won't go into a lot of detail on this today, but as we get into interpretation, it becomes very important, the 3 that are more structurally compromised, and that is that they tend to be variants of the other 12 personalities that you see here that have more of a structural difficulty within the personality itself. So you see a shift then, so that what we see as clinical disorder is actually in the mid-range, schizotypal, borderline, and paranoid. Normal style, really the idea of normal doesn't fit perfectly as far as that goes, but the more functional variant being eccentric, unstable, or mistrustful, where a person really is showing consistent personality difficulties, but not yet at the disordered level. And then at the higher end, we have some of the older terms that Dr. Millon brought back, defining these as personalities, schizophrenic personality, not to be confused with schizophrenic spectrum of syndromal features. Cyclophrenic being a less functional borderline, paraphrenic being a less functional paranoid. So how do we then begin to look at where these fit along the lines of each one of the polarities that we spoke of before? When we speak about personalities and functionality, we're looking at the rather plainly colored arrow in the center of each one of these. And that is that a person can move with some level of flexibility and adaptivity between these different motivations, probably defaulting to some area or range within each one. But if I could draw your attention then to the bottom component of that, we have along one side what happens when a personality tends to become more stagnant or fixated at one particular component. That is, a person may be strong on one area but weak at another, and perhaps average at yet another. We also have the polarity dynamics, and that is where we tend to have conflicts. We tend to have different motivations that affect one versus the other throughout a personality structure. And I'll give you some examples as we go along with these. A convenient way to break these down is something that is somewhat akin to the clusters of personality that we find in the DSM system, the ABC structures. But here we have kind of an A, B, C, and D defined through different terms. And that is that we can characterize a group of the personalities as having sort of their main area of difficulty, their main area of clinical interest being in one domain or another. And I'll go through each one of these: the interpersonally imbalanced, the emotionally extreme, the intrapsychically conflicted, and the structurally compromised, each one having a group and a spectra of their own. Begin with the interpersonally imbalanced spectra. That is, those that tend to show their difficulty or their mismatch with their context and their environment related to how it is that they relate to themselves versus how they relate to other people. These include a passive self-orientation, or the dependent spectrum, passive other orientation, an active other orientation being along the histrionic line, passive self-orientation being narcissistic, and active self being antisocial. I'll go into detail on one to show you kind of how this works overall. We look at the CENarc spectrum, that is the narcissistic spectrum, what makes up the MCMI 4 scale 5. What we have here primarily relates to a person who assumes that they do not have to, in so many ways, do all the things that a person would need to do to get the things for themselves. It's kind of an entitlement. So it's a passive self-orientation. The world will be there for me. Others are there for me. And the world is kind of built in a way which serves my purposes. To a certain degree, having a level of this would be described as confidence. Sometimes that can be its own difficulty if you're a bit overconfident. Other times it becomes more egotistic in the sense of this person really does not engage as effectively as they really should, but somehow because of the way that they align people within their world, they're able to function somewhat well. All the way through to narcissistic, where you have a very fixated point of passive self-orientation in this sort of a way. The next grouping are the emotionally extreme spectra. We have a passive with very low pleasure and low pain sort of an orientation, that is the schizoid spectra. Passive, high orientation towards pain, the melancholic, and then the active component, the active emotionally extreme spectra include the turbulent, which I'll go into a little bit more detail a little later. That's the newest of the personality patterns. That is high pleasure and active. And then the last being one we'll go into a little more detail on, active pain orientation of the avoidant. How does that work then? If a person here, the primary motivation is active pain motivated, you're going to find a person who really has very little ability to shut down, activate their parasympathetic nervous system, find comfort, find a way of just being relaxed, and instead is always on the lookout for slights, trying as best as possible to avoid those kinds of conflicts, those kinds of interpersonal interactions that might bring about some sort of a threat to the psyche. In the intrapsychically conflicted spectra, we have a kind of a reversal, and I'll go into some detail when I describe the example here. Either a reversal or a kind of a discordance or a conflict in the structure of the person overall. So we have the masochistic, compulsive, sadistic, and negativistic. And again, we'll just go into detail on one of them. I'll describe just before we get to our example the reversal that we're talking about on the left-hand column here being the idea that whatever it is that ultimately makes a person feel as though something is good or bad, something is painful or not painful or pleasurable, gets reversed for intrapsychic reasons, such that they tend to seek out the opposite, or the masochistic one in which meaning and fulfillment comes from the idea of suffering, and for the sadistic where meaning and fulfillment, in their sense, safety, comes from inflicting pain to others and witnessing and causing difficulties for others. On the other side, in terms of a conflict, let's talk just briefly about the compulsive. Passive orientation, in that this person is oriented towards doing for the world what the world is asking, and that can be behaviorally very active, but in terms of motivation is really a very passive idea, that their ideas are not that important. But really, are they? If you look at the replication strategy, the emphasis is moderately on others and really a denial of self, but that's not a clear motivation. In other words, there's some level of conflict with that, in that their needs are not getting met. They're doing for others, and no matter what they do, it never seems to really be enough to achieve a real kind of a fulfillment, which is a generator of a real kind of an anxiety and ultimately can be a form of anger. So how does that differ from the passive other orientation of the dependent, where they find their fulfillment through the other person more fluidly? In this case, they never really find that kind of satisfaction with self or with other, because there really is that kind of underlying conflict that exists there. The last grouping are the structurally compromised spectra, and these are defined by conflicts or reversals or wavering that happens throughout the entirety of the personality structure. So it's not a conflict just on one polarity or another, it's a conflict throughout. These again include the schizophrenic, cyclophrenic, and paraphrenic, each of which show their own pattern of dysfunction throughout the entirety of the personality. To just look at the most common example, the one that we're most clinically familiar with most likely is the borderline, where unlike the compulsive that we just looked at, where there's a conflict on just one of the polarities, there are conflicts on all three here. These might be more structurally compromised variants of a negativistic, sometimes compulsive, more commonly histrionic, and some of the other personality patterns. But there's been enough developmental difficulty throughout the course of the forming of their personality that they have become much more conflictual throughout, affecting emotions, affecting thought patterns, boiling down to that all or nothing kind of a feeling, boiling down to that kind of emotional ability that we typically see with this presentation. We have just a little bit of time left, and I want to get through as much of the functional and structural domains and just kind of give you an overview of that. As we sometimes anticipate, and didn't anticipate as well this time, we have a lot of material that we fit into a short amount of time, such that I think we're best to just be able to cover as much of this as possible. And what we'll be able to do then is, if you have follow-up questions, if we don't get to them during the live presentation, you can put those into the chat box, and we will do our best to answer those via email subsequent to this presentation. What I want to look at here is the idea that we have these different motivations in personality. We've spent quite a bit of time, the evolutionary polarities. That needs to give rise to something we spoke about at the very beginning of this presentation, and that is the functional and structural domains of personality, or what we might call the personality expressions, in those different areas like we spoke about before: behavioral, phenomenologic, intrapsychic, and biophysical, being four of those major areas. Divided roughly into functional domains, which are those that we might be able to observe more readily, such as emotional expression, which really speaks to behavior, interpersonal conduct, cognitive style, and also including one more unconscious process that we do tend to see as something observable, that is our defense mechanisms, intrapsychic dynamics. On the other side of this spectrum, then, we see the structural domains, those that we have to infer a bit more: self-image in the phenomenologic realm, and then two intrapsychic areas Intrapsychic content, basically being object relations, object representations, and intrapsychic architecture being the way that the inner world is structured. And then finally, mood and temperament, and what we can infer from a biophysical substrate and how that gives rise to personality and behaviors. To describe some of these areas, I want to go through the turbulent personality briefly and speak to this new personality spectra, which looks at a pleasure-active orientation, the only one of all of the personalities that Dr. Millon described that has an emphasis on pleasure and a very active modifying sort of a strategy such that this person probably pursues at a healthy level good, healthy pursuits, draws people in, gains social support, is able to help people get engaged, is able to be something of a leader in the more functional variant. But at a certain point, when a person becomes misattuned to their environment, when they are too enthusiastic, when they are drawing people in without really understanding where another's individual boundaries may fall, we start to see the overall structure here that we look at for all the different domains of personality. Here we have the turbulent spectrum and quite a number of different features, all defined by those different areas of inquiry, such as emotion, such as cognitive style, and the largest of these being really the ones that tend to be most prominent in a personality prototype, such as what we see in each one of the instruments. Briefly then again, what we're able to do with all of these, if you look down the very beginnings of the left-hand side here, we have disorder range, schizoid, avoidant, melancholic, and so on. And then across the top, you see all the functional and structural domains. So an emphasis that we have here is that these are comparable between the different personality structures and functions. Okay, the last part that we have here very briefly, and this is I'm just going to use as kind of a teaser for the next webinar, which is going to go into interpretation, is what happens when you start to admix the different personalities, which is what we really see when we start to interpret an MCMI. We don't see just one elevation. We see combinations. This is an unusual but does exist kind of a combination of narcissistic and avoidant. Let's imagine we're giving an MCMI-4 and we see this combination. What would that mean? Well, we would definitely see, if we look at the second polarity, the adaptation polarity, that there's a very strong conflict going on here, one being very passive, one being very active. We can assume that there's probably a conflict between the personality styles, such that a person who may appear to be body and try to kind of present an outside shell of being strong, being better than others, and maybe even somewhat entitled, may be hiding and masking fears of humility, fears of humiliation, and so on and so forth. We can look at the general motivations. We also are able to identify, here we're looking at the facet scales that are a component of this overall scheme of all the different domains of personality. But we're able to identify some of these expressions as well. What we're going to do then, again, we're at the top of the hour. We unfortunately will not have time for the questions that we would, but if you type any questions into the chat box, we will do our best to get back to you within the next several days to be able to answer anything that might have come up during this time. To wrap things up, I'd like to turn this back over to Dr. Gloria McCoo for any kind of concluding comments.
Thank you so much for your presentation, Dr. Grossman, and thanks everybody for attending. We hope that you'll be able to join us for the second webinar in the series, and we hope you enjoy the rest of your day. Thanks, everybody.